The construction of an integrated care in the community model, working alongside general practitioners and specialized care, involves all general practice and hospital teams which serve more than 3/4 of the needs of a given territory's population. This collaborative dynamic leads care teams to agree processes and types of relationship under a system of shared result objectives. Today, more than half of territories have already started implementing care models in diseases of the musculoskeletal system and ophthalmological problems, with joint working groups comprising general practice and specialist care professionals. One of the experiments with innovation and organizational change with the best results is teledermatology. This new care model, based on collaborative work, has halved the number of days spent on the waiting list and has also enabled very early diagnosis of melanomas. The reorganization of emergency care seeks to respond adequately to the various types of demand for immediate care. Visits to hospital emergency departments continue to decline, while care from other Level 1 systems with greater resolution capacity, or the 061 Catalonia response service itself, absorb and manage the less complicated demand. This reorganization in each territory, with processes and relationships agreed between the various systems, is also an important step in moving towards a network services setup. The Catalonia-wide organization of the portfolio of highly specialized services involves creating strategic alliances to achieve critical mass that gives the public high-quality services with the best results and the greatest safety. Some of the areas of care with the most progress has been made this year are surgical oncology of the rectum, stroke code for ischemic or hemorrhagic cerebrovascular incidents, MI code for treating acute myocardial infarctions, polytrauma code relating to polytraumas, pediatric diseases, particularly as regards metabolic, neuromuscular, and cognitive behavioral pathologies. Oncology is one of the fields of care where activity to ensure sufficient critical mass and offer high-quality services to the public are concentrated. As regards results in surgical oncology of the rectum, the public hospital network has gone from 43 to 27 authorized centers. According to the clinical audit of the Master Plan for Oncology, the rate of relapse has gone from 19 to 9% since the reorganization. In the field of neurology, we would highlight the good results with cerebrovascular diseases thanks to the stroke code. The professionals of the network of county hospitals, the 14 benchmark hospitals, and the Medical Emergency Service, SEM, are working to reduce response time for strokes, since this response time is key to improving survival and patients' subsequent quality of life. Similarly, one of the new things introduced this year is the rollout of the Teleictus 2.0 system, which includes 10 county hospitals connected to their benchmark centers and a duty center with a telephone that is operative 24 hours a day, where a vascular neurology specialist has a computer video conferencing system, enabling him or her to see patients live as well as their CT scans. That has reduced the time for reperfusion treatment when indicated and has saved on unnecessary transportation in over half of cases. As regards treatment, reperfusion treatments as a whole have increased to 16.1%, while the rate of intravenous thrombolysis for the population is 14%. Catalonia's results in this regard rank alongside the Netherlands in second place in Europe, behind only Finland. Furthermore, improvements in care for the acute phase of strokes have resulted in a 7.1% decline in deaths over 7 years. In the case of acute myocardial infarctions, MI, too, response time is crucial for good public care results. In Catalonia, there are 5 services operating 24 hours per day, as well as 5 part-time services to respond to MI code cases. These improvements have led to a reduction in the time between diagnosis of the infarction and reperfusion. Also, in 2012, care for patients with polytraumas and serious traumas was expanded with the implementation of the polytrauma code, which involves 50 centers throughout Catalonia. In total, 92% of situations of risk to life are reached within 20 minutes, which is a 2% improvement on the previous period. Finally, it should be mentioned that great progress has been made with care for pediatric diseases, especially metabolic diseases. Also, as part of the health plan, a register of people suffering from pediatric diseases has been created, along with a search tool for clinical laboratories for diagnosis. As regards neonatal preventive detection programs, the healthcare systems test is now capable of detecting 19 hereditary metabolic illnesses to add to the 3 that it could already detect. Over the coming months, the map for benchmark centers for metabolic diseases should be rolled out. This month, an agreement has been concluded to set up benchmark centers in pediatric cognitive behavior and neuromuscular diseases.